Can someone with diabetes eat fruits? One of the commonest questions I'm asked when a patient comes to consult me. Of course they can. Fruits are good. Fruits contain a lot of nutrients, they contain antioxidants, and they contain all kinds of things which are good for your health. Only thing is, a person without diabetes can have 4, 5, 6 fruits per day. They can live on fruits. Fruits contain what is called as fructose. It is a kind of sugar, and that fructose, after it enters into the body, gets converted into glucose. It takes a little bit of time, but ultimately it gets converted into glucose. So whatever fruits you take, it will ultimately get converted into glucose. And therefore, for a person with diabetes, limit the number of fruits that you take. Maybe you can take 1 fruit a day, maybe 2 fruits a day. If you're going to substantially reduce the rest of your carbohydrates, if you're going to cut off your rice, if you're going to cut off your wheat intake, then of course you can take more fruits. But otherwise, if you're taking your otherwise normal diet, on top of that, 1 fruit is okay. Maximum of 2 fruits are okay. Take the fruits as whole fruit, cut the fruits and take it as whole fruit. Don't make it into a juice. Don't buy fruit juices in the market thinking that they are very good for you. They are all very, very sweet. Even if you make the fruits into a juice yourself, even then the sugar content goes up. And therefore, use cut fruit. Now, which fruit should you take? There are fruits which have a lower glycemic index and therefore they don't increase the sugar. There are others which have moderate glycemic and some which have very high glycemic index. The ones that a person with diabetes can take are guava, apple, orange, maybe a little bit of pineapple, and also watermelon. So these 4 or 5 fruits are good. They are high in fiber and low in glycemic index, and therefore they can be taken. There are other fruits like grapes and so on, which you'll have to eat fairly large quantity, and therefore the glycemic load goes up, and preferably those kind of fruits are avoided. Of course, the king of fruits is mango and also jackfruit. Extremely sweet, and if you take lots of it, the sugar is going to go up. But people say, well, I'll just take 1 mango. I won't eat any other fruit per day. Go ahead, take that, no problem at all. And when you take the mango, as I've described in another video on mango, take it maybe in between the meals, limit the portion of mango that you take, and then even mango should be all right. So the bottom line is, take any fruit you like, but you'll have to have some idea about which are the fruits which are better for you, and also take the right amount of fruit. You can't go overboard with them and take as many fruits as you want. Remember, fruits do have their nutrients and they are therefore very useful for people with diabetes. Generally what I say is, try to take fruits of different colors, because each of those fruits with different colors have different phytonutrients in them, and therefore instead of sticking to 1 fruit, change the type of fruit that you are taking so that you get the complete benefit. What about banana? Banana has a little more starch, glycemic index and the calories a little higher, but it's a rich source of potassium. So for people who have high blood pressure, taking a banana a day reduces the blood pressure because it increases your potassium. It also helps in constipation and so on. So again, a banana is not a strict no-no. In fact, no fruit is a strict no-no. We should encourage people to take fruits, but just follow the rules of fruits if you have diabetes. Thank you.